prolotherapy injections, which are most traditionally are dextrose, sugar, usually about a 15%, and which is more concentrated than what's in your bloodstream. And so it's a little irritating to the body to have a high level of sugar in a tissue where it's not used to it. And so your body's going to have to respond in some way. And there's ideas of how it responds and how it affects inflammation of nerves. It actually calms inflammation of nerves, the sugar. And then it also, we think, stimulates some repair process because your body has to get more blood flow to the area to kind of clear that out.
Sure.
Right? So that you have to do repetitively. Most people need at least 3 or 4. But you're not just treating the inside of the joint, you're treating all the soft tissue around the joint that could be affected. So the tradition of Prolo is to actually inject broadly in these soft tissues around the knee to get some repair in all those rather than just the cartilage itself, right?
Do you include the cartilage itself and the surrounding?
Well, not injecting into the cartilage, but inside the knee so that it kind of bathes the really what you're treating is the synovial lining, the lining of the joint. You're trying to improve the health of that.
Right.
So, and then the cartilage is going to do better if the synovium's doing better.
Sure.
Right. So,
because that synovium is producing that thick, healthy joint fluid in an ideal situation.
And in unhealthy joint fluid, there are actually abnormal inflammatory signals that can break down cartilage. So inflammation can be a maladaptive thing that goes on for a long time that actually contributes to the breakdown, decline of health. So there's it's complicated, right?
Yeah,
we talked about that. So there are times you want to calm inflammation down, but it's not necessarily through corticosteroids. You can calm it down with sugar, which is very counterintuitive.